Assalamu alaikum. I'm Professor Dr. Hayder Mubarak. I'll present the first lecture in anatomy of the thorax. The title of the lecture will be Osteology of the thoracic cage. As everybody know, and as it is shown in this figure, that the osteology of the thoracic cage is formed anteriorly by the sternum. Posteriorly, the thoracic cage is formed by 12 thoracic vertebrae, and on the sides, the thoracic cage is formed by 12 ribs. And therefore, in order to consider the topic of the anatomy or osteology of the thoracic cage, we must start with describing the features of these parts of the thoracic cage. First, the ribs. Generally, terminology of the ribs are applied according to the attachment of these ribs. And as you can see that the first to seventh rib are attached posteriorly to the vertebra, while they are attached anteriorly to the sternum. And thus the ribs from 1 to 7 could be termed as vertebro-sternal ribs, and actually another name for this vertebro-sternal ribs is true ribs. The other ribs, apart from the first to number 7, could be described as false ribs, considering that the first to 7 are the true, so the next 8 to 12 may be described as false ribs. And actually these false ribs could be classified also according to the attachment of them into ribs from 8 to 10, the ribs 8, 10, 9, 8, 9, 10 are called vertebro-costal false ribs, because posteriorly they are attached to the vertebrae, while anteriorly they are attached to the costal cartilage of the rib above them. So the 8, 9, 10 false ribs are actually vertebrochondral according to their attachment, while the false ribs 11th and false rib 12 are called floating ribs or free ribs, because they are not attached to anything anteriorly. They are free anteriorly, and posteriorly they are also attached to the thoracic vertebrae. Again, what is important to be reported here in consideration to osteology of the ribs, that sometimes the 7th cervical vertebrae have a rib also. Usually the ribs starting from the first rib is attached to T1 vertebra. C7, the 7th cervical vertebrae, should not be attached laterally to a rib. But sometimes in about 0.5% of population, you may find a rib attached to C7 vertebra, and this rib is called cervical rib. It may be discovered accidentally during chest X-ray examination for any reason, for example, chest infection, and actually it does not usually produce any clinical feature, or it may produce a pressure on the underlying structures, and as this figure of the cervical rib shows, that this rib may produce a pressure on the lower trunk of brachial plexus and the subclavian artery, and thus the clinical features may be resulting from pressure on the lower trunk of brachial plexus or the subclavian artery in a syndrome which is usually called thoracic outlet syndrome. This syndrome, therefore, characterized by weakness of the muscles of the hand. These muscles are supplied by the lower trunk of brachial plexus, and the pressure on this lower trunk lead to weakness in this muscle. Or there may be absence of radial pulsation, feeling of radial pulsation when the arm is abducted and laterally rotated or externally rotated, a sign which is usually described as Addison signs indicating cervical rib. Back to osteology of the ribs. We have to say that the ribs, as you can see in the figure, runs obliquely above. Posteriorly, they are higher than anteriorly. And such obliquity is increasing as we are going downward. So the lowest ribs are more oblique than the higher one. Also, the length of the rib are increasing as you are going from the first down to the seventh rib. The seventh rib is the longest rib. But after the seventh rib, you can see that the ribs becomes shorter and shorter downward. As we said before, that we have a certain type of a classification for the rib as vertebro-sternal true ribs and false ribs, which are vertebrochondral and floating. But we have actually another type of classification for the rib. That in other classification depends on the morphology of the ribs. Here we may call the ribs as typical and atypical because they are carrying typical features of rib or deviating from what is typical. So actually ribs number 1, 2, 10, 11 and 12 are atypical, but other ribs from 3 to 9 are typical ribs. What makes ribs from 3 to 9 typical? Because they carry the following features in anatomy. Usually the typical rib from 3 to 9 have anterior end shaft and posterior end. So the anterior end of the typical rib is usually attached to the costal cartilage, and usually this anterior end is concave. The shaft of the rib is flattened from side to side, and thus it has an outer or lateral surface and inner or medial surface. And also because it is flattened from side to side, it has the typical rib has a rounded upper border and a sharp lower border. The sharp lower border shows a groove from inside, which is called costal groove, that usually contains the intercostal nerves and vessels. Also, we can see posteriorly the shaft contains an angle, an angulation, which is about 5 centimeters from the tubercle of the rib, which is part of the posterior end. The posterior end of the ribs, of the typical ribs, shows a head, neck, and the tubercle. And you can see that this is a magnified figure for the posterior end. The posterior end head shows two facets, an upper and lower facets, separated by a crest. And you can see that in this figure, the facets of the head are articulating with the body of the thoracic vertebra. The lower facet of the head of the rib articulates with the body of the vertebra of the same number, while the upper facet articulates with the body of the vertebra above, and thus the crest between the upper and lower facet is related to the intervertebral disc. Also, we have to say that neck of the posterior end of the typical rib is related to the transverse process. Actually, the neck lies anterior to the transverse process of thoracic vertebra, and the tubercle of the rib lies on the outer surface of the posterior end, and it articulates usually with the tip of the transverse process of thoracic vertebra. Actually, the tubercle of the ribs represent the junctional region between the posterior end and the shaft. Anything lateral to the tubercle, this is the shaft, while the tubercle is representing the end of the posterior end of the typical rib. So, what are features of the atypical rib that must different from these we had just described. And we said that the atypical rib include ribs 1, 2, 10, 11, and 12. The first rib, which is atypical, is the first rib. You can see that this is the figure for the first rib. What makes this first rib atypical? First, it is shorter than other ribs. Second, it is flattened from above downward, not like the typical rib, which is flattened from side to side. The first rib is flattened from above downward, and thus the atypical first rib has an upper surface, a lower surface, a convex medial border, and a concave medial border, and a convex lateral border. In addition, you can see that the upper surface of the atypical first rib shows two grooves. The posterior one is for the subclavian artery and the lower trunk of brachial plexus, while the anterior one is for the subclavian vein. And these two grooves on the upper surface are separated by a tubercle on the inner border, which is called the scalene tubercle, that serves for articulation of a muscle in the neck, which is called the scalenus anterior muscle. Also, you can see that the first rib contains only one facet on the head. It does not contain two facets on the head separated by a crest, just like the typical rib. Apart from these features of the atypical first rib, we have to report here some relations which are not included in the features of being atypical, but should be mentioned here. That the neck of the first rib is usually related to four structures anteriorly, which are from medial to lateral, sympathetic chain, first posterior intercostal vein, the superior intercostal artery, and T1 nerve. The other atypical rib, as we said, is the second rib. Actually, the only feature that makes the second rib atypical, being diagnosed as atypical, is that apart from being it is shorter than the typical, but the second rib contains a large tuberosity on the middle of its lateral surface, which is called tuberosity for serratus anterior, serving for attachment of a muscle which is called serratus anterior. Other features of the second rib simulate those of the typical. Going to the atypical 10th rib. The atypical 10th rib has a one facet on the head. It does not contain two facets on the head separated by a crest. And the atypical 11th and the 12th rib, as you can see in this figure, also have a one facet on the head similar to that of the 10th rib. But in addition to that, the 11th and the 12th rib do not have a neck, do not have a tubercle. It has a slight angle or a shallow angle, and it has a slight costal groove or even an absence costal groove. So all of these features are features of the osteology of the ribs as parts of the thoracic cage. Now I will describe osteology of the sternum that forms the anterior part of the thoracic cage. As you can see, the sternum is formed of manubrium, then body, then xiphoid process. So the sternum is formed of three parts. The manubrium is quadrilateral. Its upper border is formed by the jugular notch in the middle, and on the sides of this jugular notch are facets for articulation with the clavicle, while the lateral border of the manubrium articulates with the first costal cartilage and with upper part of the second costal cartilage. The lower border of the manubrium articulates with the body of the sternum. You can see that the body of the sternum articulates with the lower part of the second costal cartilage, third costal cartilage, fourth, fifth, seventh, sixth and seventh costal cartilage. You can see that the seventh costal cartilage actually articulates with the junction of the body and xiphoid process, and actually we have to say that the xiphoid process is mostly cartilaginous and young, but it ossifies later on. Finally, we have to talk about osteology of the vertebra. Again, just like the ribs, we have to classify the vertebrae of the thorax into typical and atypical. The typical vertebrae are from number 2 to 8, T2 to T8. Features of the osteological features of the typical thoracic vertebrae include the following. First, the body of the typical thoracic vertebra is heart-shaped, and on the sides of the body are demifacets for articulation with facets of the ribs. And of course, you can imagine that the upper demifacet articulates with the rib of the same number, while the lower demifacet articulate with the ribs below. In addition to that, you can see that the pedicles of the ribs of the vertebra directed backward, and you can see that above the pedicle and below the pedicles are superior and inferior vertebral notch respectively. You can see that the superior vertebral notch is shallow while the inferior vertebral notch is deep, and these superior and inferior vertebral notch actually form the intervertebral foramina and subsequent chain of thoracic vertebrae. Again, you can see that the upper demifacet of the body of the typical thoracic vertebra lies on the root of the pedicle, while the lower demifacet of the body of the vertebra lie in the anterior end of the inferior vertebral notch. Again, we have to say that the typical vertebra shows a superior articular process and facet and inferior articular process or facet. You can see that the superior articular process and facet lying in the junction of the pedicle and lamina, and these superior articular facets are directed backward and laterally, while the inferior articular facet and the process lies in the lamina, and they are directed medially and forward. The transverse process of the typical thoracic vertebrae, again, they project from the junction of the pedicle and lamina. This is pedicle and this is the lamina, and you can see here the projection of the transverse process and the projection of the superior articular process. The transverse process of typical thoracic vertebra is long and is directed backward and laterally. The anterior aspect of the tip of the transverse process shows a facet for articulation with the tubercle of the ribs. The spine of the typical thoracic vertebra is pointed and is directed downward, obliquely, and backward. So these are the features of the typical thoracic vertebra, which are vertebrae from number 2 to 8. Anything deviated from these features will be considered as atypical thoracic vertebrae, which are number 1, 9, 10, 11, and 12. Number 1 have got the following features. The body is not heart-shaped, it's broad. And in addition to that, the other features of the atypical first thoracic vertebra is that the body on the sides contain upper complete facet, not demifacet. Still we have a lower demifacet, but the upper demifacet is complete. It is not demi, because it articulates with the head of the first rib that contain a one facet also. And the spine of T1 is not so oblique. It's nearly quadrilateral, nearly broad, nearly not long, just like the others. The atypical 9 and 10. First, I'll describe the atypical 10, and then I'll tell you what about the atypical 9. Actually, this is a figure for the atypical 10th vertebra. You can see that the atypical 10th vertebra contains complete facet, upper facet on the body, with no demifacets below. And again, this is because T10 rib, the 10th rib, also has one facet on the head. So, similarly, the T9 atypical vertebra has only an upper facet, but it is a demifacet. So, if a vertebra have got an upper facet and no lower facet, and you don't know whether this is a 9 or 10, you have to look for the upper facet. If it is a complete facet, this is a typical 10th vertebra. But if it is an upper demifacet, so this is a typical 9. Both of T9 and T10 have no lower demifacet. The atypical 11th vertebra, as this figure shows, simulates the T10 vertebra, as it has no lower demifacet and has a complete upper demifacet, complete facet on the body. But what makes you differentiate between T9 and T11 is that the transverse process of T11 does not show a facet for articulation with the tubercle of the rib. Back to the figure, you can see that T10 shows a facet on the transverse process, on the tip of the transverse process, to be articulated with the tubercle of T10, but T11 does not shows a facet on the transverse process, on the tip of the transverse process. However, both T10 and T11 have a complete upper facet and no demifacet below. Finally, the T12. Actually, T12 could be very easily demonstrated as being atypical, because most of the features of T12 simulates the lumbar vertebrae, the shape of the body, the pedicles direction, the transverse process. Just look to the spine. It is horizontal, quadrilateral, and short. But what makes you differentiate this T12 vertebra from lumbar vertebrae is that T12 vertebra shows a complete facet on the body. The lumbar vertebrae do not have a facet for the ribs, because T12 is the articulates laterally with the 12th rib. Again, something else which is very clear in T12, that the inferior articular process in typical vertebra is directed medially and forward, but here in T12 it is directed laterally and forward, and I think this is a very clear feature differentiating it from other vertebrae. Actually, these are most of the topics related to osteology of the thoracic cage, and I think it's enough to mention these. And in next lecture, which is lecture 2, I'll talk about some other features of the thoracic cage apart from osteology. Maybe we can call the topic of the next lecture, lecture 2, flesh or soft tissue of the thoracic cage. And thank you very much. Thank you for listening.